I am here to discuss to you all about my topic, which is laryngeal cancer. So let's get started.
Laryngeal cancer. So, what is laryngeal cancer? Laryngeal cancer is cancer of the larynx, which is part of the throat. It happens when specific cell grows uncontrollably as cells multiply, they invade and damage the body. In laryngeal cancer, these cancerous malignant cells start in the larynx or the voice box. What is larynx, by the way? Larynx is in the throat. It's also known as the voice box, and larynx help us speak, breathe, and swallow. Our vocal cords are part of the larynx, and larynx is mostly made up of cartilage, a flexible tissue that makes up a supportive framework. The larynx has three parts, which are the supraglottis, the upper part. More than 1 in 3 laryngeal cancers start here, and the glottis, which is the middle part. More than half of the laryngeal cancers, or the 60%, start here. And lastly, the subglottis, which is the lower part. About 5% of laryngeal cancers start here. What does the larynx do? The larynx helps us breathe. The vocal cords open to let air through and speak. The vocal cords close. As air passes through the vocal cords, they vibrate, helping it create speech sounds. And lastly, swallow. The epiglottis, part of the supraglottis, drops down over the larynx. The vocal cords close to keep food out of the lungs. What are the risk factors for laryngeal cancer? Smoking or using tobacco, which are the common risk factor. Drinking alcohol. Age. Laryngeal cancer happens more in people age 55 and older. Gender. Men are more likely to develop this cancer, possibly because smoking and heavy alcohol consumption happen more among men. History of head and neck cancer. About 1 in 4 or 25% people who have head and neck cancer will get it again. And job. People who have exposure to certain substances at work are at higher risk. These substances include sulfuric acid mist, wood dust, nickel, asbestos, or manufacturing mustard gas. People who work with machines are also at higher risk. Some forms of HPV or human papilloma virus, a sexually transmitted disease, can cause laryngeal cancer. Pathophysiology. Etiological factors are the smoking, using tobacco, and drinking alcohol can cause a carcinoma of the squamous cell lining of the larynx, causing rapid metastasis of the carcinoma due to abundant lymphatic vessels into lymph nodes and lungs. So normally, cells in the body will grow and divide to replace old and damaged cells in the body. This growth is highly regulated, and once enough cells are produced to replace the old ones, normal cells stop dividing. Tumors occur when there is an error in this regulation and cells continue to grow in an uncontrolled way. Tumors can either be benign or malignant, although benign tumors may grow in an uncontrolled fashion sometimes. They do not spread beyond the part of the body where they started or metastasize, and do not invade into surrounding tissues. Malignant tumors, however, grow in such a way that they invade and damage other tissues around them. They also may spread to the other parts of the body, usually through the bloodstream or through the lymphatic system where the lymph nodes are located. Over time, the cells within the malignant tumor become more abnormal and appear less like and appear less like excuse me, and appear less like normal cells. This change in the appearance of cancer cells is called the tumor grade. Cancer cells are described as being well differentiated, moderately differentiated, poorly differentiated, or undifferentiated. Cancers are described by the types of cells from which they arise. A majority of laryngeal cancers develop from squamous cells, which are found in the epithelium of the larynx, which is the innermost layer of lining of the larynx. Therefore, they are referred to as squamous cell cancer of the larynx. Most squamous cell most squamous cell cancers start not as cancer but as a precancerous condition called dysplasia. Usually, dysplasia does not turn into cancer. At times, dysplasia can progress into cancer in which cancer cells are limited to the epithelium. This is called carcinoma in situ. There are also other very types laryngeal cancer including minor salivary gland cancer, sarcoma, and melanoma. What are the signs and symptoms of laryngeal cancer? Voice changes, hemoptysis, hoarseness, dyspnea, respiratory obstruction, dysphagia, weight loss, pain, aspiration and swallowing, persistent unilateral sore throat, dysphagia, weight loss, mass in neck, and hemoptysis. Stages of laryngeal cancer. Early laryngeal cancer in stages 0, 1, and 2. The tumor is small. Cancer has not spread beyond the larynx. Advanced laryngeal cancer in stages 3 and 4. The tumor has grown larger. It's affected the vocal cords or invaded the lymph nodes or other areas of the body. Diagnostic procedure. Excuse me. Physical examination, health history, indirect and direct laryngoscopy, pan-endoscopy, CT and MRI scan, PET scan, biopsy. Treatment modalities: radiation therapy, chemotherapy, immunotherapy, and surgery. The targeted drugs are there are the targeted drugs like cetuximab or Erbitux given to manage laryngeal cancer that has spread outside the larynx. Targeted drugs may help to destroy cancer cells while avoiding healthy tissue, resulting in different or more tolerable side effects. Surgical management include chordectomy, supraglottic laryngectomy, hemilaryngectomy, partial laryngectomy, total laryngectomy, thyroidectomy, and laser surgery. Nursing management in partial laryngectomy assess ABG values and pulse oximetry, semi-Fowler's to high Fowler's position, monitor the oxygen therapy and tracheostomy care and suctioning, chest physiotherapy, and nebulization. Nursing management in total laryngectomy assist in tube feeding, start oral feeding with fluids and semi-soft foods, communication, provide patient pen and paper or communication board, keep speaking with the client or the patient and do not avoid conversation because it will build up his or her frustration. Nursing diagnosis. Ineffective airway clearance related to partial or total removal of the gluteus, altering ability to breathe, cough, and swallow. Impaired verbal communication related to physical barrier tracheostomy tube, and impaired skin or tissue integrity related to surgical removal of tissues and grafting. That's all. Thank you.